watching Fox 10 Arizona Morning with Ron Hoon, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD.
Hey, good morning, everyone. We are live out here in Mesa. We're going to speak with the doctor who is a breast cancer survivor, as well as going to kind of give us an idea of what to expect in the doctor's office after you might feel a lump after you do your self-exam at home. It is Breast Cancer Awareness Month. We're going to have that story kind of coming up in just a couple minutes.
Breast Cancer Awareness Month, and many women are reminded to do a self-exam to check for lumps. Syleste Rodriguez is with a breast cancer expert to talk about the 5 things that you should do after finding a lump. Super important information, Syleste. Good morning.
Hey, good morning to you, Andrea, and good morning, everyone. Yeah, a lot of times women actually find, lumps themselves, when you do these breast exams at home. And so you find this lump and you think to yourself, what to do next? What can I expect when I go into the doctor's office? Well, we have Dr. Caryn Doudna here with us this morning. Thank you for being with us. I appreciate your time.
Thank you for being here.
Tell us what to expect once we come to see you. What can we expect in the doctor's office?
Well, women do find their cancers on breast self-exam, and the important thing is that you do a breast self-exam so be familiar with your body and what your breasts feel like. If you do find an area that you're uncertain about, it feels maybe a lump or a thickness, it is important that you not panic. Most findings on breast self-exam are not cancer, but that you follow through with your doctor, you contact your healthcare provider, and you get a mammogram order and an ultrasound order, and follow through with scheduling that appointment.
And I believe we're showing some video of some mammograms being done. At that point, would you come in, obviously, for a mammogram after you come in to see the doctor, right?
You do come in and have a mammogram and an ultrasound and any additional testing that might help us evaluate your breast to find out what is happening, what your breast cancer represents, and what step is next. At EVDI, we believe that women need the information, and when a woman comes into our office to have a problem evaluated, they will talk with the doctor and leave with a report and know what the recommendation is. If the next step is a biopsy or if their finding is benign, I think that information is really empowering for women, and they need to know what's next with their body and what their health is.
When you speak of an x-ray, mammogram, biopsy, let's take a look at this image that you have right here. And can you kind of walk us through kind of what this looks like right here as far as someone coming in to see you?
This is a woman with a very dense mammogram, and she's feeling a lump. You can see this little BB marker that's placed on her breast. That is placed at the time of the mammogram, so we know exactly what is being evaluated. These additional white circles are areas that the radiologist has marked where they want additional evaluation. You can see underneath the skin marker there is kind of an ill-defined area of increased density which represents the patient's cancer. When we see a finding on the mammogram, we're not finished. We take the patient to ultrasound to look at that area to get more information regarding that mass to determine if it's a significant finding or if it's a benign finding. If it is a finding that we're uncertain about, and most masses found on breast imaging are not breast cancer, but many of them need to be biopsied, and this woman went on to have an ultrasound-guided needle core biopsy and the diagnosis of breast cancer.
Something that I think probably a lot of patients likely feel probably very comfortable in speaking about this with you is that the fact that you yourself are a breast cancer survivor.
I am. I'm an 18-year breast cancer survivor. My very first year in practice after finishing my breast imaging fellowship on breast exam at age 37, I found a lump. And it was a small invasive breast cancer. And that early diagnosis really saved my life and gave me treatment options to proceed with the minimal treatment for breast cancer. And I'm here 18 years later, very healthy.
Oh, good for you. Congratulations on everything, on, being able to, kind of eradicate that breast cancer.
You're very welcome.
Can you talk a little bit about what you did after? Did you go through chemotherapy, radiation?
I had a lumpectomy and radiation therapy. At the time, I was not recommended for chemotherapy because of the early diagnosis of breast cancer. And that's one of the options of early detection, either through mammography or finding on breast self-exam, is early detection is really key. And 3 out of 4 women are diagnosed with breast cancer have no family history. And I think that's so important for women to understand that you need to get a screening mammogram and do your, starting at age 40, and do your breast self-exam even younger than that.
Yeah, one of my doctor actually recommended it at 35, and I know some doctors we have a little bit of a family history in my family, but you were saying that you even see some women in their 20s, which is a little rare, but you do see them.
We do. I mean, usually women diagnosed in their 20s with breast cancer have a significant family history and often a genetic abnormality. That is not the general population. For women of average risk, which is every American woman at age 40, they need to start screening at age 40. There are women with a genetic abnormality or other risk factors. They may need to start screening mammography before the age of 40, and they need to talk with their physicians about who's appropriate to begin earlier.
Okay. All right. Caryn, thank you so much for your time. Appreciate it. Thank you. Yeah, guys, I mean, as Breast Cancer Awareness Month, I think it's a good time to remind everyone to kind of take the time to do something like a self-exam at home, you know, something as simple as just a few minutes in the shower, you know, to kind of check yourself and make sure everything is just okay.
Yeah, and do it even in your 30s. I mean, it doesn't hurt. You should do it every month, regardless of it being October or not. This is just a great month to talk about it more. But good information.
Just a good reminder.
Yeah, great information. Thanks, Celeste. Appreciate that.